For today's focus on the health industry, we welcome Nurse Dennis Morgan.
Thanks for having me, Bruce.
So Dennis, how did you decide on nursing as a profession?
Great question. Well, most young people have at least some idea about what they want to do when they finish high school or college. In my case, I had no idea at all. I didn't love high school and I wasn't the best student, but I loved science classes, especially biology, and I did pretty well in those courses. Another strange thing about me was that I hated the sight of blood, and one time I fainted when my sister cracked her head open. But all during school, I really wanted to do something where I could help people. So I decided to take a first aid course. It was a great experience and inspirational. And soon I started working at the Red Cross to volunteer.
And what about your fear of blood? Wasn't that a problem?
Yes, it certainly was. But with training and interactions with patients, it became easier because I knew exactly what to do if someone was bleeding. Eventually, I made the decision to become a nurse and study for 4 years to earn my nursing degree.
So what kinds of classes did you take during your program?
In the first year, my classmates and I took foundation courses, focusing predominantly on nursing and caring skills. There were also modules on human biology, psychology, communications, and patient health. In the second year, we began our specializations in areas like adult nursing, child nursing, mental health nursing, or learning disability nursing.
Could you tell us where you work and explain the kind of equipment you use as a nurse?
I work in a hospital downtown, and my main responsibility is to provide patient care and support. The basic equipment we use includes a stethoscope, a pen light, forceps, bandage scissors, and a watch with a second hand. In the hospital, you need to be familiar with vital sign kits, which monitor a patient's heartbeat and blood pressure, and include a thermometer to take a patient's temperature. Also, you need to be able to use an IV pump, which is used to provide patients with medicine or liquids. Without question, you definitely need training to use some of this complicated equipment.
Would you agree that a nurse needs to have technical knowledge as well as care for and care about people?
I think you need a number of qualities to be a good nurse. First, excellent people skills are imperative, meaning you need to communicate well and have strong observation abilities. Second, you must be able to work as part of a team with doctors, technicians, and of course, the other nurses. Lastly, you have to be able to answer questions and offer advice, as well as manage stress and emotional situations.
And finally, what are the job possibilities for nurses?
Oh, there are lots. Nurses can work in hospitals, clinics, retirement homes, the pharmaceutical industry, rehabilitation centers, and so many other options.
Dennis, thanks for your insights.
My pleasure, Bruce. I hope to see you soon, just not in the hospital.